jump in, I do just want to remind everyone that really the goal of the conversation today is to provide everyone who's here with information that they could go and take to their own healthcare providers. This is intended just as information, not as actual medical advice or guidance. It's really important for you to be using this to feel more empowered to have the conversations that you want to have with your medical professionals. And so now that we've got that out of the way, I'd like to start by jumping into a topic that has really been in the news a lot lately, which is egg freezing. And Dr. Sabouni, I would love for you to share with us a little bit about the work that you do, and also to share with the audience if egg freezing is something that you're curious about, that you've considered, that you've started to explore a little bit. What exactly do we mean by that? And what are kind of the basic steps that you need to take to move forward with egg freezing?
So I love that question. I'm Dr. Reem Sabouni. I am a double board certified OBGYN and reproductive endocrinologist, and I'm the director of infertility and egg freezing at Aspire Houston Fertility Institute. So egg freezing is a passion project of mine. I love it. So when we talk about egg freezing, what are we talking about? Well, here's the thing. We as women, we are born with all the eggs we'll ever have in our lifetime. It's kind of depressing to think about. And we slowly lose our eggs over time. So for us, in comparison to our male counterparts, it's a use it or lose it system. So if we are delaying childbearing for, let's say, multitudes of reasons, such as we are pursuing higher education or Prince Charming has not come along, right? Then it's important for us to think about freezing our eggs in order to kind of, in a way of thinking about it, being our own egg donor of this future. So egg freezing and IVF are actually the exact same thing. The only difference is what happens after the eggs are out. So we can freeze the eggs unfertilized so that, let's say, Prince Charming comes along in the future and you're finally ready for your family, or it becomes a better time to actually start your family, or maybe you have a little trouble getting pregnant with child number 2 or 3. Then we can fall back on these eggs that you have had since at a younger age, which means they're going to be higher quality, and we can use those eggs in order to help either start or complete your family.
So Dr. Nurudeen, I'd love for you to expand on that and get a little more granular with this process. How do you know that now is the time to freeze your eggs? You talked about the quality of the eggs. It's better for when you're younger. What is the conversation to have with your doctor if this is something you want to explore?
You know, egg freezing isn't for everyone. We definitely want to start by educating you on the process, your fertility itself. When we go through the process with you, we tell you what the testing that's involved with it. Lab tests and hormones, which we can go into detail a little bit later. But first you have to decide, what is my future planning goal for my family? What ideally do I see for planning for that future? If I do egg freezing, is it something that I'll likely use with or without a partner? Depending on the age of the patient, we'll have that conversation. Now, how do you decide if it's for you? I always talk to patients and I say, if you decide not to egg freezing, will you have any regrets about it? Are you open to the other options that are available to you, which could be adoption, it could be IVF, it could be embryo donation as well, or even donor egg. So there are other options you could consider in the future if egg freezing is not right for you. I also bring up the option of, you could also think about conceiving right now, and we make sure we have that conversation too. If fertility preservation and going through the egg freezing process is not something that's personally for you, we make sure we go through those other options. When it comes to the timeline of doing it, you really should think about your own personal future. How many kids do I anticipate I'd like to have in the future? And your current testing and your clinic success rates can actually help impact that. If you decide that I'm going to do egg freezing now, your clinic will actually go through their own specific success rates and basically make recommendations on what they think your numbers should look like at this age, what your goals should be at this age. Will these goals reach the numbers that you're looking for to have the family that you're looking for? Do I have enough eggs to get in one cycle to hopefully have 2 or 3 kids in the future? That's a great conversation your doctor will help tailor for you.
Rachel, these are all questions that you had to ask yourself when you were diagnosed with cancer a few years ago. Can you share with us your experience, what that moment was like, and how you had to rethink your own fertility journey?
Absolutely. I actually want to say I thought about freezing my eggs years and years prior to actually getting diagnosed with cancer, but I actually didn't have this kind of conversation with the doctor at the time. And it was sort of up to me to kind of figure out on my own. And my doctor just said, you have time. You're young. Don't even have to think about it right now. And then fast forward a few years later, I was diagnosed with stage 2 kidney cancer. Renal cell carcinoma is a form of kidney cancer. I had to go through surgery and all of that. And luckily, I'm one of the lucky ones and I'm fine. But when you get that diagnosis of hearing that you have cancer, a lot of thoughts start running into your mind, and you start to ask those questions of yourself of, do I want kids? What does my future look like? Do I want to preserve my eggs and all of this? And so I really had to go through a lot of life reflection of what do I see for myself in the future? And it was because of that cancer diagnosis, I really decided to say, now is the time. I had this thought before, but now this sense of urgency is really there for me. And that sense of perspective is there for me. So that's why I decided to really just bite the bullet and decide to go through the process.
So obviously there was some urgency involved in the decision that you made, but if you could go back in time without that urgency, what would you recommend to folks who maybe aren't in that situation but are starting to think about it? What are some of the lessons you learned or that you would do over again?
I would actually say I kind of alluded to it a little bit. At the time when I had first initially had this thought in my mind, I really put a lot of the onus and a lot of that authority onto the doctor, with the doctor saying, you have time, and kind of playing my future out for me. And I didn't at that time really know how to advocate for myself in the doctor's office. So I would say if you have that thought, be brave, be bold, and really take ownership of your own health and your own life and what you see for yourself. And so start to have those proactive conversations with your doctor, and find a doctor also that listens to you and that hears you and wants to have a two-way conversation with you.
Yes, proper medical advice is so important to ensure that you are receiving. And that's true no matter what kind of fertility treatment you explore. So Dr. Nurudeen, let's talk about IVF, which again is an increasingly popular way that people are choosing to have their families. So similar with egg freezing, how do you, at what point during the process of trying to conceive, do you have a conversation, or does it start even before you're trying to conceive? How do you navigate that?
That's a great question. As the director of fertility preservation, my job is also egg freezing, but fertility preservation means our oncofertility patients, and then also couples who are thinking about fertility preservation for all kinds of reasons. So IVF is included with that. So it goes beyond egg freezing. It's the same process as Dr. Sabouni said. You're taking the injections and hormones, but you're going past the eggs. They're actually going to be fertilized with sperm, whether you have a partner or deciding to use donor sperm. Now, the IVF process, to make the decision to go forward with it, is going to be individualized by the patient. There are a lot of treatment options we offer out there, but we are increasingly seeing studies that show that IVF is the most effective to get a successful pregnancy quickly. And we are, of course, as your doctor, we want to individualize it, but we also want to think about your goals and making sure we try to help you reach those goals through proper counseling. We're always open to our patients considering other options, but we also want to make sure if their decision for IVF is something we recommend, we'll talk you through how it works. Now, the success rates will depend on the patient's age, of course. The process, when it goes past the egg, we're fertilizing eggs with the sperm. And about a week later, you'll have a certain number of embryos that result from those eggs. Now, not every egg ends in an embryo. So when you're doing egg freezing, we have to anticipate what the goal will be at the end of the day when those eggs are used in the future. We have to anticipate your age at the time and your future partner as well. So we can give you some conservative numbers on how many embryos would result, how many of those embryos would be healthy, because it's really important for you to have expectations and know what your clinic success rates are, because we don't want you to go through the process, come back years later, and be disappointed with the outcomes. Now, we know it's not a guarantee, but your clinic experience is super important in making sure that we come as close to that goal as possible. After we have these embryos frozen, for a lot of patients, they'll go through an embryo transfer the following month. So the first month is focused on making your embryos. The second month could be an embryo transfer right away. And if you're not ready, it can always be put off till later. It can be put off decades later. The technology is amazing right now to freeze eggs and embryos. So you have a lot of options, but when it comes to choosing the timeline, it really needs to be individualized by the woman, her partner, or the doctor's opinion of their clinic success rates.
You've talked about how it's a bit of a journey and you're not going to be successful necessarily every single time. So Dr. Sabouni, I'd love for you to talk a little bit about how you counsel your patients to deal with the emotional up and down. We heard someone in the video describe infertility as a roller coaster. That's a lot to be dealing with. What kind of support is available? How do you navigate that? And what advice would you give to folks about how to prepare themselves emotionally?
Right. So infertility is definitely an emotional roller coaster. You're going to have your ups, you're going to have your downs. There's no straight road. There's going to be bumps, and we have to learn how to pivot when we hit those bumps. And so when we talk about, infertility, the emotional support starts as either the individual or the couple. So a lot of times this can be very challenging to a couple. And so being able to provide adequate amount of support to one another is going to be very important. Then it's your village, right? So it's finding people, because a lot of issues that people have is they feel like nobody else in the world is going through this, and there are plenty of people. So you want to find your village of people who have gone through similar experiences, so you don't feel quite as alone. Beyond that, there are different resources that you can tap into, including being able to talk to somebody. So sometimes we have to reframe when we're going through a hard time in life. We have to reframe how we're looking at things. We never want to look at things as happening to us. We want them to be happening through us, right? This is a choice. You're making an active decision to pursue treatment because this is something that you are wanting to do. You don't want to feel like you're doing it as a reaction to something that's happening to you. So in the process, I always encourage patients to think about doing healthy habits, including making sure that you're not only eating nutritiously and supporting your body, but also exercise. Exercise is so important. It's important to get those good endorphins going. And remember, this is a part of your life. This is not your entire life. You are a wonderful, successful human being that has come to this world, and this is just a small aspect of your life.
Wonderful. Rachel, did you feel that way going through it? Like, how did you get through it? What were kind of some of the low moments? I mean, you were battling an illness at the same time that you're worried about preserving your fertility. I mean, that must have been quite a lot for you to be coping with. So how did you get through it?
Yeah, there's definitely an element of the healthy habits of eating right, exercising, and kind of those basic things that, we all should do, but sometimes we don't do it. But we definitely should, especially as you go through that process. But I would say actually a lot more of it for me affected me emotionally. So it was actually incorporating a lot more mindfulness and also this element of just being really self-compassionate towards myself, showing myself some grace, giving myself a chance to really slow down during that process. I remember actually at the time I was still kind of in that go, go, go mindset of wanting to work and do all these things. And I was actually on a work trip as I had to give myself the trigger shot during that process. And I just didn't really realize the emotional impact it really has on your body and on your mind. So I would say if anyone is going through that process, really give yourself a chance to slow down and pause, and also be really open with the people that are around you in your life, because they are not experiencing it. So they don't know how you're feeling. So I think just really being open with that communication can really help alleviate and get that support that you're looking for from the community around you.
Fantastic. Yes, community, so important through all of this. I'd love for either you, Dr. Sabouni, or you, Dr. Nurudeen, to talk about what that conversation is like when someone comes to you and asks for help. It's such a vulnerable position to be in. How do you reassure them? What do you want folks to know about how it will be reassuring? Because it must be very intimidating to make yourself so vulnerable.
We've been practicing quite a few number of years, and you feel that that fear and that vulnerability when a patient walks in the room. I mean, you feel it. Your goal is to alleviate it first by just slowing down and just saying, hey, we're just here to have a conversation. I want to hear what your goals are. I want you to be able to hear what we can offer you. And we want to be supportive along the way. We know not everything's a guarantee, but we're your friend in this. A lot of us get emotionally invested in our patients and their goals, but I definitely want patients to feel at ease, because walking in the room is a big step. It's kind of scary to think about making that appointment, and some patients don't come to the appointments, and we get it. It's hard to make that step. But when you walk in the door, our goal is to just slow things down, sit down, let's learn about our bodies. If there's something you've heard, do you have friends who've gone through this? Have they given you a perspective that maybe you have questions about, and it may be important to hear from your doctor? Kind of our experience. We see a lot of women walk in with all kinds of backgrounds, all kinds of concerns, all kinds of fears, but our goal is to just kind of help you get through it and really hold your hand through the process.
I think that from my perspective, I know that Dr. Nurudeen, she kind of touched on a lot of things. I think that the big thing to remember is we get it, right? You won't be the first, you won't be the last that breaks down crying. I love when patients cry with me because you're going to feel better, right? You can be vulnerable with us. We're used to it. We want you to be open. We want to help you get to your goal. You come to us with a goal. That's our job, is to help you get to the goal. Now, we might not always get to the goal the way we thought we were going to get to the goal, but that's our job, to come up with your plan A, plan B, plan C. We got plenty of plans. We're the ladies with the plan, okay? So at the end of the day, remember, we got you.
Yeah.
We get you, we got you. Okay? That's the bottom line.
And I'm sure that is so reassuring and comforting for your patients to hear that you've got them, that you've got multiple plans. Yeah. On the flip side of that, is there anything that your patients can do that you recommend to improve the chances of plan A or B or C becoming successful? What is the guidance you give around any changes that they can make, any improvements to lifestyle that they can make?
Yeah, so nutrition's going to be an important one, right? We always want to be as healthy as possible when we're trying to get pregnant. It's a similar concept to if we're trying to freeze our eggs, right? So, maybe get a little bit cleaner with our diet, try to eat less processed foods, more whole foods, try to get your actual nutrients from fruit, from actual foods. You want to try to take increased supplementation, so maybe like a prenatal vitamin. One of the ones I love is CoQ10, which is a great one for egg quality. If your ovarian reserve is a little bit on the lower side, we can think about DHEA. But we can also tailor that when you get blood work. So if we need to supplement vitamin D, which probably most of us need some vitamin D, let's be honest. So diet is a really good one. Exercise, one that a lot of us don't really think about. We want to go to the gym, but maybe we don't go to the gym as often as we should. So that's a good one. Sleep. Yeah, sleep, 7 to 8 hours, a good one. Hydration, mindfulness, all of those are really important things during this process, because you want to make sure that you're supporting your mental, emotional, social, and physical self.
Fantastic. Anything you would add to that, Dr. Nurudeen?
I agree with everything Dr. Sabouni said. I'm a big fan of acupuncture. I do truly think that it's a stressful situation already. Acupuncture not only can help you maybe respond well to the medications and treatment, but it also help with your stress. So I'm a big fan. We have a lot of great acupuncturists that we work with who, it's a nice way for you to focus on you a little bit, because it may be hard to practice some things on your own and make changes on your own. And sometimes this is a way of being proactive and making some changes outside of the medication and the monitoring the visits.
One of the things that I think is so amazing about all of these technologies is just the choices, the options that we have. And Rachel, I'd love for you to talk about what it meant to you to know that there was a proactive measure you could take to preserve your fertility.
That's exactly it. Just the fact that we have choices and we have options, and that's where the power really is. That's where I felt it. So knowing that, maybe I wasn't necessarily ready at that time, knowing that I could take steps and be proactive and do something that felt like I could take ownership of my health was really important to me.
Yeah, great. Yeah. I'd love for you, Rachel, to build on that and share with the audience. They've heard about your journey. They've heard about the options available. If there is one thing that you would want to leave folks with, now that they have all this information, what do you want them to go out to do with it or think about?
Yeah, I actually have maybe two things, but the first thing that comes to mind for me is really just going through this sort of self-reflection process. And we've kind of been talking about it a little bit, but just having these conversations, even before you talk to a doctor, having them with yourself and really going through this exercise of, when I see my life, at 80, 90, 100 years old, what do I see around me? Who do I see around me? And kind of really paint that picture for yourself. And I think that brings a lot of clarity to especially the fertility process, the family planning process, and what that might look like for you, especially if you're someone who's maybe questioning it and not really sure. So maybe spending some time to have that reflective moment for yourself, I think is really important. And then also, even if you don't go through this whole process of egg freezing and going down that whole journey, I do think that there's still some elements that you can do to incorporate more ownership into your health. So actually even going to the doctor, getting a hormone panel test done, just to see what your body's state is at the current state, even if you're not even considering it, just to understand your body a little bit more and have those data points so that you can maybe even make choices once you learn that baseline information.
Yeah. And we've mentioned now this idea of getting your hormone levels checked a couple of times. Dr. Nurudeen, can you explain exactly what we're looking for? What does that mean? What is the test you ask for?
So probably the most common one everyone hears about is AMH, anti-Mullerian hormone. So this is a hormone that actually comes from the eggs or follicles that sit in your ovary, and they produce this hormone, and we can actually measure it in your blood, and it will kind of give us an idea of what your ovarian reserve looks like at this moment. Now, AMH is not cycle dependent. You don't have to be on a certain day of your cycle. It can be drawn at any time. It doesn't vary, but basically over time, it does decline to reflect your egg count. We also look at antral follicle count. So it's basically an ultrasound that's done at the beginning of your period. So this one is cycle specific. First day of your period is considered full flow. And we like to see between the second and third day where we do an ultrasound, and we look at each ovary, and you'll see these little circles, little black circles, and they are follicles. So we'll count the number of follicles on each side of on each ovary. Typically for AMH, we want it to be over 1. Of course, depending on your age, it's going to vary. We're going to have expectations. Not everyone is going to fall within a certain range, but the AMH can be helpful in giving us those numbers. The antral follicle count is another thing that we looked at, like I mentioned. We also look at traditionally other hormones, FSH and estradiol. These are cycle specific, but they can vary cycle to cycle. They're probably not the best predictors. When it comes to the testing we offer, the biggest point I want to make is that it's not a predictor of pregnancy. So if you do your AMH test and it shows a number that you get worried about, don't worry about conceiving, your options to conceive. It's not a predictor of, can I get pregnant now? Can I get pregnant in the future? That's not the job of the medication, the testing. The test that we do, AMH, antral follicle count, FSH, and estradiol, all it does is predict the number of eggs we could achieve if we decide to do treatment. If we decide to start the hormone therapy, do egg freezing, do IVF, and make embryos, it's just a predictor. So if we're going through that process, these numbers help us with that. Yes, every woman's going to fall within a certain range, and it helps us predict what numbers you'll end up with, but don't see it as a discouragement if your numbers are a little lower or extremely high. It's really just a predictor for us. But if you wanted to have a baby and you have no other barriers to having a baby, AMH is not a predictor of you achieving pregnancy.
Good information to know. Dr. Sabouni, you were joking back in the green room that you and Dr. Nurudeen, your colleagues, of course, that every day you talk about this. You're always sharing information with each other. And I'm curious, what gets you the most excited? What makes you want to run over to Dr. Nurudeen and say, did you hear this?
Honestly, it's when you have like that successful pregnancy for somebody who's really been trying hard. Those are the ones, especially the ones, the underdogs, right? The ones that they didn't think they were going to make it, and you're just like scrubbing your brain thinking about your plan A, plan B, plan C, and you finally get them to that milestone, and they're just so ecstatic. I mean, those are the things that just makes our day. But the funny part is that that's pregnancy, right? That's that definitive outcome. But even egg freezing, we consider to be successes. I know that when Kemi and I would be talking, and we do lots of egg freezing in our practice, we're very fortunate to have a stellar lab. And one of the things that she said to me, which I thought was so true, and it is reflected in all of my patients, is when you wake up from egg freezing, you feel like a weight has been lifted off your shoulders, right? Because all of a sudden, the next guy that you meet, it's not like he has to be the one because our biological clock is ticking. And that's so important. It's so key. And I know that it seems so silly, but it's so true. So like anytime you can help somebody kind of preserve their fertility, it really is a big deal. And it's exciting.
It's so funny to hear you say that because I was thinking the same thing. Like that weight. I mean, if you decide to go through that process, the weight is just lifted. You just feel a little bit more empowered. You feel a little bit more, okay, this is not something that's going to hold me back, you know? So, well put.
That certainly seems to have been what your feeling was.
Definitely, yeah. I agree with all of that. It definitely felt like a lot lighter. It felt like, okay, great. Like I did something for myself, and it gave me a sense of reassurance that I was being proactive, which I think is really important for anybody when it comes to their health. The only regret, honestly, is not doing it even sooner. So, I'm a big advocate for it.
It's a very important takeaway. Don't wait if you think that this is something that you want to pursue. Dr. Nurudeen, what else would you like to leave as a takeaway for the audience?
I think one of the things is be proactive. Get your education about your health, your reproductive health, period. And don't let fear hold you back. You know, I know it's really scary to think about. You'll hold it in the back of your mind, like, should I? Someone else's experience, should I do this? Just take the steps. You know, you'll find a doctor who will sit with you and take away that fear. At least educate yourself so you have no regrets in the future, and you can feel that empowerment moving forward with your reproductive health.
Dr. Sabouni, final thoughts, takeaways. What is it? If there's one thing you want the audience to remember, what is it?
I think it's just be courageous. You know, we have done so much in our lives to build us to this place where we are today. More women are valedictorians. More women are graduating college. More women are graduating from graduate degree programs in comparison to our male counterparts. So we are likely delaying childbearing. And so the most important thing is that it doesn't have to be mutually exclusive. You can have it all. It might not just be the way you envisioned it. So be proactive and be courageous.
Well, that is the perfect empowering note to end this conversation on. I'd like to thank Rachel, Dr. Nurudeen, and Dr. Sabouni for joining us today. Thank you so much.